All right, today we're going to talk about a really serious health issue that affects millions of women, and a whole lot of them have no idea they even have it. It's this silent threat that can have some pretty severe consequences, so it's about time we brought it out into the open.
Just think about this for a second. What if a common, totally treatable infection could be moving through your body right now without setting off any alarm bells? But all the while, it's capable of causing long-term damage that could literally affect your ability to have children. This isn't some hypothetical scenario. It's the reality for anyone dealing with pelvic inflammatory disease.
So let's just dive right in and start with the basics. What exactly is this silent invasion we're talking about? We're going to break down pelvic inflammatory disease, or PID as it's often called, and really get into why its hidden nature is what makes it so dangerous. Okay, so to put it simply, PID is an infection of the female reproductive organs. The best way to picture it is an inflammation that starts low, maybe at the cervix, and then spreads upwards. It can end up affecting the uterus, the fallopian tubes, and sometimes even the ovaries. So it's not just one little localized thing, it's a widespread infection that takes over the whole upper genital tract. And that word, silent, is absolutely the key here. So many women with PID have zero symptoms. Nothing. No pain, no fever, nothing that feels out of the ordinary. And that means the infection can just go completely unnoticed and, of course, untreated for a long time, all while it's quietly causing damage that can't be reversed.
So, you might be asking, who's most at risk? Well, PID is most common in young, sexually active women, especially those between the ages of 15 and 24. This is exactly why getting the word out to this age group is so incredibly important. All right, now let's zoom in a little closer and look at the inflammation itself to see how all this damage actually happens.
Okay, now we're going to zoom in and get a little more specific. See, PID isn't just one single condition. It's really more of an umbrella term that covers a few different types of inflammation that can happen inside the reproductive system.
So, as we said, the infection usually starts low down, in the vagina or the cervix, and then the bacteria start to travel upwards. They literally ascend, invading the uterus, fallopian tubes, and ovaries. It's this upward journey that really defines what PID is.
And under this PID umbrella, you find a couple of really specific conditions. Two of the most important ones to know are salpingitis, which is an inflammation of the fallopian tubes, and chronic endometritis, which is a persistent, kind of low-grade inflammation of the uterine lining. Both of these can have incredibly serious consequences, like infertility or even life-threatening pregnancies. So what's actually causing all this? Well, about a quarter of all PID cases are caused by two STIs you've definitely heard of, chlamydia and gonorrhea. But here's the thing, it's not just them. PID is often what's called polymicrobial, which is just a fancy way of saying multiple different types of bacteria are all involved at the same time. This can include really common bacteria like Streptococcus or even E. coli.
Okay, so given that PID can be totally silent, you're probably wondering, how on earth do you diagnose it? It's a great question. Spotting this enemy is definitely tricky, but there are some signs and methods doctors use to try and uncover it. While a lot of women don't have any symptoms, some do get warning signs. And these can be pretty vague, things like a dull pain in the lower abdomen, or they can be more specific, like pain during sex, unusual discharge, running a fever, or even bleeding after intercourse. If any of those things are happening, that's your body's signal to go get checked out.
The diagnostic process usually starts with simple cervical swabs to test for bacteria like chlamydia and gonorrhea. But, and this is so important to know, a negative swab does not rule out PID. The infection could be hiding higher up in the reproductive tract, or it could be caused by different bacteria that those standard tests just don't look for. So, for a deeper diagnosis, especially for something like chronic endometritis, doctors have to bring in more advanced tools. The main takeaway here is that there's no single perfect test. They might need to look at tissue samples under a microscope, or use a tiny camera to look inside the uterus, or even do special tests to find specific bacteria. Each method has its own pros and cons, so it's really the combination of these tools that helps them get a clear picture of what's going on. So, once PID is finally diagnosed, what's next? Well, the good news is, it is treatable. So let's take a look at how doctors actually fight back against this infection to stop that long-term damage before it gets any worse. The main weapon against PID is a course of broad-spectrum antibiotics. Broad spectrum just means the drugs are designed to target a whole wide range of potential bacteria. The treatment usually lasts for 14 days, and, this is critical, it has to be started immediately. Sometimes doctors will even prescribe it before the test results are back, just to stop the inflammation in its tracks.
And these are some of the common antibiotic cocktails that are used. You'll see combinations like doxycycline, ceftriaxone, and metronidazole. The reason they use a combo is to cover all the bases. It'll hit chlamydia, gonorrhea, and even what are called anaerobic bacteria, which are tricky germs that don't need oxygen to survive. Now listen up, because this part is absolutely vital. The treatment doesn't just stop with the person who was diagnosed. As our source material makes crystal clear, all of their sexual partners from the last 6 months have to be tested and treated too. If they aren't, you can just get reinfected, and that whole painful cycle starts right back up again. Okay, we've talked about how to fight PID. But what happens if it's not caught in time? This is where we get into the really serious stuff. The lasting scars this silent infection can leave behind. The number one thing to understand here is that every single delay and every time the infection comes back, it matters a lot. The longer that inflammation is allowed to go on, the more scar tissue can form inside the reproductive organs. And it's that scarring that leads to some absolutely devastating long-term complications. 1 in 10, just let that sink in. That's how many women with pelvic inflammatory disease will end up struggling with infertility as a direct result. That inflammation can completely block or damage the fallopian tubes, making it physically impossible for an egg and sperm to ever meet. And if we drill down and look specifically at salpingitis, that inflammation of just the fallopian tubes, the odds are even worse. 1 in 6 cases of salpingitis will lead directly to infertility. It just shows you how targeted and destructive this damage can be. But the scarring from salpingitis does more than just cause infertility. It can also partially block a fallopian tube, so a fertilized egg can get trapped on its way to the uterus. This is what's called an ectopic pregnancy, where the embryo starts growing where it shouldn't. It's a life-threatening medical emergency, and the risk of it happening increases by a staggering 7 to 10 times after you've had salpingitis. And believe it or not, the damage doesn't even stop there. Untreated PID can lead to something called a tubo-ovarian abscess, which is a dangerous pocket of pus. It can cause chronic, debilitating pelvic pain that can last for years, and in some rare cases, it can even cause something called Fitzhugh-Curtis syndrome, where the inflammation spreads all the way up to the liver. So after all that, we're left with this: a common, often totally silent condition with absolutely life-altering consequences for women's health and fertility. Which brings up the real question, doesn't it? Given how serious this is, why aren't we all talking about this more? Because sharing this kind of information could truly make all the difference.